a lot of women really believe that they have to be super mums, super women, super mums, and that relaxation is not necessary. This is a great area of improvement for most women. Relaxation is not a luxury, it is a necessity.
Moms absolutely have to take a break from time to time and have time for showering and eat and drink. And I know it sounds almost impossible to do, but you actually have to keep in mind that if you are out of oxygen, then you are not going to be able to do a good job taking care of your child.
It's very important for women who have postpartum depression to make sure they feed themselves regularly throughout the day. They get pretty busy with baby and forget to feed themselves. So we really encourage them, to eat their 3 meals and to take time for a little break and a snack in between.
For postpartum moms, they're often putting themselves second to babe or to their family needs. So just eating well, getting enough sleep, getting some exercise, and having some social interaction with close friends can do a world of good to lift her mood.
There's also simple little ways of exercising rather than getting out and going to the gym. Teaching a mum that while she's waiting for the kettle to boil, she could do a couple of squats. While the mum is on the floor with the baby, while the baby's having some tummy time, the mum can do some yoga positions or some different gentle stretches. Little things that bring her back into her body, that help her pay attention. Mums often have all sorts of little aches and pains just because they're in these positions breastfeeding and they're holding baby and they're trying to soothe baby. And so they need to pay attention again to their body. When babies are first born, all the focus is put on baby, and then gradually they need to slowly bring a bit of that focus back to themselves. That's part of looking after the baby. If the mum's not looked after, she's not going to be able to look after her baby.
I really start with sleep when I talk about self-care.
Sleep is probably the most important thing that mom needs postpartum to make sure she's getting enough of. We know with lots of evidence that moms who don't get enough sleep will not function. They will absolutely have a lower mood and be at much increased risk for mood disorders. And I tell my patients their goal is at approximately 6 hours of sleep somehow within a 24-hour period. It's rarely all together, but if they can do 6 hours, they will function enough. But consistently getting less than that, and they probably won't.
Self-care is, we look at things like exercise and we look at diet. Are you eating breakfast? Are you taking time to relax? Are you taking time for your spirituality? Are you having the support of others and really connecting with other people in your life who are dear to you? Or are you just sort of doing the tediousness of life and surviving?
With a baby, everything feels like an emergency, but we can get into that heightened state if we're not careful. So bringing ourselves back down, taking a few deep breaths can help with that. Same when if a mum is dealing with very intense emotions or thoughts, and she feels like they're taking over, to be able to just sit for a moment, whether it's with her baby or on her own, and just, okay, it's okay, I'm just right here, and just breathe herself back down can be huge in just calming all of that down just a little bit.
I recommend acupuncture to some of my patients when they have specific pain problems in pregnancy, when they're interested in ripening their cervix prior to labor, and sometimes for helping to term bridge babies. There's some evidence that they can help turn babies. So there's certain times when we use acupuncture during pregnancy. Yeah.
In my practice, I have treated women who have come with anxiety and depression perinatally and also postpartum, and a lot of people respond well, but sometimes it takes more than one session, and so we tell people to sort of they can expect different results. Sometimes women have to resort to a whole host of resources to find the relief and the care that they need, and that can include counseling, that can include things like yoga, that can include checking in with your family doctor and making sure that you're covered every step of the way, and different things work for different people, so you won't know until you've had access to all these different resources.
During a time in my life that was stressful, I started to go to yoga classes, and I find so many benefits, exercise, just well-being. I think the main thing that I find is that just bit by bit it helps you become more fully yourself and live your life in a way that you want to live it.
Women should not hesitate to seek out resources in their community. There's so many things available to help within the healthcare community, and sometimes it's difficult because if it's their first time experiencing postpartum depression, they might not even recognize the signs at first. Family members might not even recognize, loved ones, but everyone's affected and impacted, and sort of the quicker that someone can appeal to these sources of support, the faster they can begin to feel like themselves again and feel better. So I definitely think women should not hesitate and not be embarrassed and not be ashamed to talk to someone about what they're feeling and to seek out whatever resources are necessary for them.